Today we're going to go through a DSLR camera and how that is very different than what we're utilizing for a point and shoot camera or a smart device. With this camera, the biggest complaint that we have from team members is that it's heavy, it's hard to memorize exactly what the settings are, and we're going to go through that a little bit later. But the first thing that we want to talk about is our full face photos and really getting and capturing exactly what we need from the patient. As we go through today, I'm going to share with you what happens when we utilize the automatic flash and the automatic settings on the body, and most importantly, when we use a manual setting. And I'll go through the difference today and really be able to show you how much better the manual setting is. But I want to touch on a couple quick tips and most importantly, make sure that you're getting the best photos that you need for your practice. So the first photos that we're going to take as the patient comes in the room, we're going to take our full face photos. When we go through that, we are going to talk and I'll show you a lot of different images that you can take. The series is really just based upon what your doctor wants you to do. But what I want you to also think about is taking these photos. Patients do not know that it's a bad photo. All you have to say is, I'm going to take it again. All right, that's beautiful. You know, they don't know, right? So again, if you say, I don't like that one, I don't like that one, then they're going to start wondering, do you know what you're doing? So one of the things that I'll do, and you'll hear, is like, oh, beautiful, looks great. All right, one more, right? That's the beauty of using digital. So encourage the patient, but you want to be confident, okay? Even if it's your first time. The first photos that I'm going to take are going to be a full face. We're going to do kind of a rest position because she's going to be referred to the orthodontist. I want to make sure that I gather whatever photos we need for that. Then I'm going to get a profile. And after that, we're going to talk about our intraoral images. So remember that we talked about, why important it is to really look at these dials, okay? So remember that as we take our full face photos, we're going to roll the dial or turn the dial down because I want to just look at, we were on manual, we have automatic. I'm going to roll it just a little bit past that line. That's usually my guide, okay? Because we're going to have to get closer to Kylie. The other thing is don't forget to change your f-stop. You'll see here that 32 or 22, just based upon your camera, okay? Remember we talked about the lighting and the camera, but I want to think about this. I needed more light inside the mouth. And so now what I'm going to do is just scroll this down some, and I'm going to go, some people like 8 or 9. On this camera, we're going to use a 5.6. Again, this is where you're going to have, take the photos, talk with your doctor about it, ask them which one they like, and decide and keep it there. So you always have 2 f-stops, and that's it. You don't want to have a whole bunch of numbers, and it leads to, again, consistency. So the first photo I'm going to take is going to be straight across, and again, I'm using my grid, getting a really good image here. You can see that we've got from the shoulders up and enough space equal on each side. Now what I'm going to do, Kylie, is have you nose smile, okay? Just like that, and look dead at me. You hear that light? That light tells us that we're in the right place. Now, a lot of times that's perfect and we don't have to really make any changes, but we went horizontal. My doctor likes to see vertical, and we use that, again, a lot when we're referring to an orthodontist or when we're utilizing it for laboratory communication. So I'm going to take one of those, and I'm just going to change I want you to give me a big smile. And again, Kylie likes to turn her head, which I'm glad because I can kind of troubleshoot it, okay? Nice and straight, because if the patient has, an automatic, kind of curvature to the mouth or a little bit of a cant, I don't want to change that. I want the lab to be able to see this is where she is and it's exactly where, her teeth fit in her face, right? So nice and straight, okay? And I'm going to back up, and I am going to, again, I'm going to turn my camera straight up, get her right in the frame, moving my body. Remember, we're not touching the dial, okay? Beautiful. I'm going to take one more, only because I just want to get a little bit closer in case he wants it. Listen for the beep. Notice here, I'm going to show the camera, I really like this photo better than the horizontal. I always feel like I cut the top of the hair off. Now, I want to touch on something really quickly. Do you see how her hair is sticking out? I'm really funny about my photos. I don't like that. So I'm going to go to her, and I do this to patients, not just because she's my granddaughter. I'm going to take this and hide it. You got this curly, beautiful hair, but I don't want that to be where a patient's eye would normally go. They'll be like, oh, what about my hair? Or I've got some hair in the frame on my face. So cute. I'm going to just quickly take those photos again so they'll be able to see the difference. So now that I've fixed her hair, I want you to see the difference. It's ever so slightly, but it does make a difference. And patients really appreciate the fact that you're telling them, hey, I'm going to fix your hair, or there's something on your face. Better yet, there's something in your nose, right? Be very picky. Take these photos and be proud of them. So now what we want to do is we have all of our patients turn to the left, right? And this is going to be our profile shot. What I want to do is I really want to make sure that my line and my grid comes right down in her ear. That's my focal point. Notice a lot of times when we turn, patients will start to take their head and tip it down. So Kylie, if I was going to take the photo here, her head would be down. The other thing is notice her hair is over the ear. We see this a lot. With a profile photo, that's not what's supposed to happen. So Kylie, I want you to take your hand and just kind of put your hair over your right behind your ear. There we go. Just so I can see it. Perfect. Okay. So chin down. And if this is the way they are, I want you to raise your chin just a little bit. Keep coming, keep coming, keep coming. Right there. I'm going to move my body in and out. Remember, I'm not touching the dial. Move your body in and out, making sure you're really nice and focused. Really nice. Now, I love vertical. I like it so much better than horizontal. So while you're staying right there, Kylie, I want you to bring that head up just a little bit. Hear that? I feel like she might have moved. So one of the things that I want you to look at is a little bit of that shadow. You see that shadow behind her? I don't want that. And I can tell you the orthodontist is not going to want that either. So Kylie, take one step towards me. There we go. And I'm just going to, I'm going to have to back up, right? But I don't have that shadow. This is sometimes we'll blame it on the camera. But the further away she moves closer to me, the less shadow we're going to have. You'll see that it wasn't as prominent. One of the things that I want you to think about is look at how I'm holding the camera. I've got stability here. I've got my finger on the trigger, I'm holding it correctly, and I've got it here. Some people like to actually hold it here, but I always found that I kind of moved it a little bit, and I don't want to do that. So I like to take it and really grasp it. Making sure though, if you're using a lens and also a ring flash, that this is straight up, not turned to the side. You see that? Straight up. So as we go, I'm going to just hit my button again to make it live. We changed it to 32. Now I want to make sure I didn't move anything. The other thing about some of these cameras is we actually can lock it, so you can't really move it. And that's what I would suggest you do. So Kylie, I'm going to come in, and I want you to give me the biggest smile, big smile, and I want you to say just like that. Now, I want you to come in close here because I want you to see what happened. She's ever so slightly canted. Because why? She's got a habit of doing that, right? You saw. I love it because this way I can show you that this is what, some of the troubleshooting you want to think about. Beautiful. And so I'll share with you that, again, she's got a tiny mouth. Sometimes we might have to come out just a little bit because she is young, okay? But if you look here, you do see, and I train people to say, you know what, you don't want to see a whole bunch of the face, but she's tiny. I always try to remember that and really look at the photos we took the last time she might be in and just know that when I take that photo, I'm like, oh, I see a lot of the face. So I might need to come out just a little bit. But let's talk quickly, chin to lip. I want the same distance. Upper lip to nose. Notice that I'm dead in the center. I moved her head to make sure she's straight, but I want to come in just a little bit more. So for young adults, remember we were on the line for adults, I'll just ever so slightly come here. And this way you don't get as much tissue in the frame. And I'm going to turn, remember you talked about the ring flash, you see how that was turned? Don't hold it underneath. Hold it in a C position. Chin up just a little bit. There you go. Hear the beep? Much better. And you may say, well, Shannon, it's not a big difference, but I feel like I'm dead in the center and I really don't have as much of her face. Now, Kylie, just your lips together, okay? Chin up. Okay, let's take that one more time, right? Looks great, looks great. We're gonna take one more. Chin up. You heard the encouragement, right? Chin up, looks great. We're gonna take one more. Why? Because I wasn't happy with it. So you can see here, again, same thing. A lot of these images you may not be taking, but I want to just kind of show you what's possible, and maybe there might be some that you never took before that you want to switch to. The next one that we're going to have Kylie do, because Kylie has a class 3 bite, which means the lower jaw kind of comes up and under, which is why she's going to go through ortho. But what I want you to think about is this, even for elder, I say elder, I'm old myself, but as we get older, we know things start to fall. And when we're doing aesthetics, and we'll talk more about this in the lab portion, is that the lip will come down and we don't see a lot of tooth structure. So if Kylie was older, I would do what's called the E. When we say E, we'll have the patient do that, but what we're looking at is teeth from the lip all the way down to the incisal edge, because we can look and see, wow, how much tooth structure is she showing as she's talking, okay? And this will really help. I love that. So Kylie, I want you to look at me, and again, love that head tilt, girlfriend. All right, so Kylie, what I want you to do is just say, ee. There we go. And sometimes you'll say, well, it doesn't really look any different than the smile shot, but you'll be surprised on some of those patients, the difference. Notice too, I'm dead in the center. Sometimes we can move and we'll be off. You don't want that. We want the same distance in the corner of the smile, same distance over here. So the next photo that I'm going to take is a tip down. We'll talk again more about that in the lab communication. But the tip down is where the patient actually brings their head down and they smile really big, because we're looking at the relationship of those incisal edges to the lip. So even though we're not going to do any aesthetics on Kylie, I'm going to take the photo anyway just for demonstration. So Kylie, I want you to tip your head down and I want you to give me a really big smile. Great. And I actually like this photo. What I like is just the fact that we can see this image. Looks really good. I didn't think we really would want to do that just to show it for video purposes, but I'm glad we did, because you can see where those lower teeth are coming up and over the anterior teeth. That's really going to be valuable for the orthodontist, and they're going to be happy that we took this photo. So this photo is one that you don't have to take, but because we take a lot of images for the Academy of Cosmetic Dentistry, this is part of the series. So if you're ever, your doctor's ever going to get accredited, these are very important photos. And I just want to demonstrate those to show you, because remember, you're going to decide what sequence of images you're going to take. So this photo, again, going back to the smile, and let's just say we're going to shoot a smile for Kylie. Now what I'm going to do is I'm going to have what we call the lateral shot. So I'm going to have Kylie smile really big and turn her head just a little bit to the side, and I'm going to come in, and really my focus is going to be on the lateral. Big smile. So you can see here, I got the lateral right in the center of the frame. So that's the right. Now I'm going to jump to the left. All I'm going to do is keep them right where they are, and I just want them to move. Really important. So this way, I know I'm going to get it dead on. Smile really big, 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 big. So notice here, I've got a nice right and left. Very similar. That lateral is right in the center. But let me show you something really quickly. If I scroll back and I scroll forward, they're dead on. So this is where, I'm being so picky. You're like, Shannon, really, you're so picky? But guess what? There's nothing that gets doctors excited than having great photos.